Dr. Pooja, to begin with, what is PCOS and how does it affect fertility?
So PCOS, or the polycystic ovarian syndrome or polycystic ovarian disease, sometimes these terms are used interchangeably. It is a hormonal disorder which causes, irregular periods as well as other physical symptoms of, excessive male hormones in the female body, such as hair loss, acne, unwanted hair, difficulty in conceiving. So it consists of a spectrum of conditions that cause PCOS. So any of the two things is present among the three things, which is irregular periods, signs of excessive male hormones, and the third is the ultrasound appearance of polycystic ovaries. Any of the two, among these three criteria, when present, we say that a polycystic ovarian syndrome is present. Now this condition, it is becoming quite common these days, because much of the cause also depends on the person's lifestyle. So if we take too much of junk food, we take too much of stress, or we follow a very sedentary lifestyle, which is when the polycystic ovarian syndrome, that increases in severity, and it becomes a vicious circle. So when unhealthy lifestyle is followed, it leads to weight gain and symptoms of polycystic ovarian syndrome. And the weight gain, then in turn, it also aggravates the symptoms. Now, polycystic ovarian syndrome, that not only affects the fertility, but it is also affects the pregnancy. So because the periods are a bit irregular in many ladies with polycystic ovarian syndrome, the ovulation also doesn't happen each month. The ovulation or the egg production also becomes irregular, which is how it becomes difficult to conceive. Also, many women, even when the ovulation is happening regularly, but because there are hormonal imbalances which are not very conducive to fertilization or implantation of the embryo, which is why the chances of having a pregnancy may decrease further. Also, the chances of having a miscarriage, they also increase in women who have polycystic ovaries. Also, some other complications such as developing diabetes, a small baby or an abnormally large baby, operative delivery, cesarean section delivery. Apart from this, abnormal weight gain during pregnancy. All these conditions also increase when a lady has polycystic ovarian syndrome. Hence, adequate treatment, adequate attention should be paid to women who have this condition, because not only does it affect fertility, it also affects a pregnancy.
Thank you, Dr. Pooja, for answering that. I'm going to now take the first question that comes from Methili Mankrekar. And she says, I have PCOS since the last 13 years. And due to taking proper food and doing exercise, I have conceived. Should I take any extra care? And also, I'm experiencing severe hair loss since 12 years and still facing the same problem, even after taking folic tablets. She's mentioned she's taking folic tablets. What to do? Please help me. So it is her 13th week during her pregnancy.
Hi, Natalie. So that's very good that you have followed a healthy lifestyle over the years. You have done exercise, which is why your periods have become regular now and you have conceived. But the polycystic ovarian syndrome, the precaution regarding that should be continued into your pregnancy also. So first thing to do would be to remain in regular touch with your doctor, and do follow a healthy lifestyle in pregnancy also. So if you are following any kind of exercise, do take an approval from your doctor what kind of physical activity you can do during pregnancy, such as walking, or it could be brisk walking or pregnancy yoga. These activities should be continued into the pregnancy if your doctor feels it safe for you to do. Apart from that, many women, they are prescribed some medications such as insulin sensitizer and all during pregnancy, before the pregnancy, when they are trying to conceive. So do ask your doctor if there is need to continue any of those medication during pregnancy also. And in all situations, do go by the advice of your doctor. It would be very good to exercise 30 minutes every day. If it is difficult for you, do follow in a walking routine of 30 minutes every day. Follow a healthy diet as you have been doing already. So take plenty of fruits and vegetables, plenty of protein diet, but cut down on the carbs. it would be good to consult your dietitian also. If you are planning a meal, try to cover half the plate with plenty of fruits and vegetables, healthy fruits and vegetables. And taking an early breakfast, avoiding stress is also a very important thing, because stress also aggravates PCOS. So these are the things that will go hand in hand with your doctor's advice. Now, hair fall can be related to the abnormal hormones which are there when a lady is pregnant. So do take your doctor's advice regarding medication. Specific nutritional supplements can be given to you. However, in pregnancy, other specific treatments for hair fall, they are withheld, because the safety of all of these treatments, they are that is not known. So I would say in pregnancy, stick to a good hygiene routine for your hair. Hair wash should be done more frequently. Ask your doctors for safe supplements, a healthy diet, and plenty of fruits and vegetables that would help you in curbing hair loss during pregnancy. Other treatments can be looked after once you deliver your baby. Also, some women, they have hair loss during pregnancy also, which is because of the hormone up and down. So it will, generally get all right and come back to the usual one, the, your hair growth pre the pregnancy once your delivery happens. So I would say do consult your doctor and follow your doctor's advice on this. All the best.
Thank you, Dr. Pooja, for answering that. We hope, Maithili, you've heard all the tips that Dr. Pooja has just mentioned. In case you have any more questions, please feel free to get back to us. Richie Ghai from Pune says, I'm planning to conceive. I had my last period on the 12th of August. We had intercourse during mid of September. Till now, I have not got my periods. I sometimes also have irregular periods. What to do? Please suggest me.
Hi, Richie. So I would say the first step would be to test for a pregnancy. You can go ahead first with a urine pregnancy home kit using the first urine sample of the day. The more accurate method would be to go by a blood pregnancy test. Do consult your doctor on this. If there is no pregnancy, then you should consult your doctor, because as you have told us that you sometimes do get irregular periods. So then the need for checking up the cause for irregular periods is there. You should get your thyroid hormone checked. Certain other checkups, such as a checkup for ascertaining polycystic ovarian syndrome or prolactin levels, that should be done for you. To help in conceiving and to regularize your periods, you should also follow a healthy lifestyle and exercise, regularly. Follow your doctor's advice and take whatever medication they give you if any, hormonal disturbance or thyroid is found out. Because, once we treat that, then, their chances of having a pregnancy, they increase. So I would say that do test for a pregnancy and get in touch with your doctor after that. All the best.
Thank you, Dr. Pooja. We're joined by Parentune expert, senior gynecologist, Dr. Pooja Mittal, to talk about how can PCOS and thyroid affect your fertility in this Parentune workshop. Shivani says, I follow a healthy lifestyle. My weight is also normal. Periods are also regular. And also, I have been exercising over more than a year now. But recently, I got to know that I have PCOS. My AMH level has come as 10. Yeah, so her AMH level has come as 10. She says, please suggest what should I do? Is my PCOS mild or severe? She further adds that I'm taking medicine for this also, and I'm also planning a second child. What should I do?
Hi, Shivani. So you are doing all the correct things that should be done when you have PCOS. In fact, otherwise also following a healthy lifestyle, exercising regularly, that is something that all should do for their good health. Yes, your AMH, the anti-Mullerian hormone, is in the higher range, which frequently happens when women have PCOS. And in such a situation, you can go ahead and try for a pregnancy. It is for your doctor to advise you on this. Whenever we give medication for helping achieve a pregnancy, sometimes the response that comes is a bit exaggerated when AMH is high. So that is something your doctor will take care when you'll consult your doctor. But I would say that in case you are not having other symptoms apart from this high AMH, any other symptoms of polycystic ovaries, such as weight gain, abnormal hair such as on chin or tummy, acne, hair fall, and your hormone levels such as the FSH and LH, they come in the correct range, then we can say your polycystic ovaries, that is in the mild range and not a severe one. So I would say don't worry, continue, following the healthy lifestyle the way you have been doing. Take the medication that your doctor has advised for polycystic ovarian disease, because that will help you a lot. And you can try for a pregnancy. In case the success is not achieved after 6 months to an year of trying, then you can consult your doctor for a help regarding this. But I would say, in case you are following all the advice given by doctor, taking medication, and also following a healthy lifestyle, the chances are very good that you will conceive again and you'll not have problems. Also, just this polycystic ovarian syndrome, this is not something that can be cured completely. It's something like a tendency that stays with you. So as long as you are following a healthy lifestyle, it will not cause you symptoms or any problems, but the tendency probably doesn't go away from your body. So in case you stop following all the precaution, it will come back. So, which is why, despite doing everything, your hormone level AMH is still high, because that tendency is still there in your body. But would be very good if you follow all the advice of your doctor, follow the lifestyle. Definitely, you will conceive and achieve a healthy pregnancy. That is all the best.
Thank you, Dr. Pooja, for answering that. Shruti Beniwal is 34 years old and she's from Gurgaon. She says, I'm a 34-year-old female trying to conceive. I have thyroid TSH as 8.1. I consume thyroid medicine from 2 weeks, she says. Please tell me, can I conceive? I'm also worried about pregnancy. Please suggest me, how should I go ahead with this?
Hi, Shruti. Since you have told us that the thyroid medication you have started 2 weeks back. So yes, the TSH is high. It is in the range of 8. And you need to continue your thyroid medication very regularly. But sometimes, it will come down only when you have taken the medication for 4 weeks to 6 weeks. So if you want to repeat the thyroid levels to see that, they have, been brought back to normal, or if there is a dose adjustment in the thyroid dose that is needed, you need to repeat your test in 2 weeks have already lapsed, another month you can repeat your TSH levels as well as the free T3 and free T4 hormones. So follow that report up with your doctor, and your doctor will advise you what type of dose, how much of dose you should take regarding thyroid hormone. So if your thyroid levels, the TSH levels, the thyroid hormone levels, they continue to be in the normal range with medication, then the bad effects that this disorder, hypothyroidism, that has on your body, they are annulled. And then in that case, you will not face a problem with conceiving. You can go ahead and try for a pregnancy once your thyroid is normalized. You can also look at visiting your doctor for a preconceptional checking and tests, so that if there is any other problem, that can also be taken care of. Apart from this, do follow a healthy lifestyle. Exercise regularly for 45 minutes a day, 6 days a week. Take a healthy balanced diet, avoid junk food. And in addition, avoid stress, sleep regularly, sleep adequately, follow a healthy lifestyle. So that will really help in keeping your body healthy and keeping it ready for a healthy pregnancy. Apart from this, thyroid, if not controlled during pregnancy, that can cause, various complications. Chances of complications increase, including developing high blood pressure, developing diabetes, excessive weight gain, or, problems with the baby, such as a small baby, problems with development of the baby. All these increase if thyroid is not adequately controlled during pregnancy. So during pregnancy also, you will need a periodic checkup of the thyroid hormone levels, and you should consult your doctor regarding this. Once you conceive, then also you will remain in regular checkup, regular touch with your doctor. And do take your medicine regularly. It is best to take empty stomach in the morning and not to take anything half an hour after that. There are also some foodstuffs that are to be avoided in people who have thyroid problems. So some of these are, excessive amount of, some vegetables such as cabbage, spinach, broccoli, cauliflower, sweet potatoes, strawberries, etc. It is better to cook them rather than having raw. Apart from this, do follow your doctor's advice regarding the test and the dose of thyroid. I hope this will help you.
Thank you, Dr. Pooja, for answering that. We hope, Shruti, that you've heard what Dr. Pooja has mentioned. If you have any more questions, please let us know. We'll be happy to take them up. Mani Nagpal from Ahmedabad has a question in Hindi. She says, मेरी शादी को 6 years हो चुके हैं. Still, I don't have a baby. Doctor has said that your both tubes are blocked. Please tell me how can I conceive? And my thyroid level is normal. But the thing is, I don't know exactly मुझे क्या करना चाहिए. तो इनका question, Dr. Pooja, is not really related to PCOS or thyroid. She's mentioned that doctor has told her that her tubes are blocked. So how should she go about it?
हाय मनी, देखिए जब ट्यूब्स दोनों ही बंद होती हैं तो कंसेप्शन के चांस के लिए एक तरीका बचता है, वो है इन विट्रो फर्टिलाइजेशन, जिसमें कि आपका एग रिट्रीव कर कर एम्ब्रियो बाहर बनाया जाता है बॉडी से बाहर, और फिर उस एम्ब्रियो को हम बॉडी के अंदर डाल देते हैं। बिकॉज ट्यूब्स का ओपन होना, पेटेंट होना तो जरूरी है, तभी जो एग है वो ओवरी से ट्रेवल करके इम्प्लांटेशन के लिए यूट्रस तक आ पाएगा। तो एक ऑप्शन है आपके पास इन विट्रो फर्टिलाइजेशन, दूसरा ऑप्शन है लेप्रोस्कोपिक सर्जरी कर कर, हिस्ट्रोस्कोपी कर कर साथ में। ये खास तरीके की एंडोस्कोपिक सर्जरीज हैं जिन्हें करके अगर पॉसिबल है तो जो बंद ट्यूब्स हैं उनको खोला जा सके। लेकिन सभी सिचुएशंस में ट्यूब्स को खोला जाना पॉसिबल नहीं होता। ये आप एक अच्छे फर्टिलिटी स्पेशलिस्ट एंडोस्कोपिस्ट से मिलिए और उनसे बात कीजिए कि आपके पास क्या ऑप्शंस हैं। अगर सर्जरी करके ट्यूब को खोला जा सकता है तो यस, यू कैन ट्राई नेचुरली ऑल्सो, but the other option remains IVF. And I would say, yes, you have waited 6 years for that, but since if your tubes are blocked, then rather than keep on trying like this, do consult a good fertility specialist for all the tests, maybe a rechecking of the patency of the tubes, and also if a surgery is required or needed to open those tubes. तो आप अपने डॉक्टर से बात कीजिए। अगर आपके डॉक्टर एडवाइस करते हैं कि सर्जरी करके ट्यूब्स को ओपन किया जा सकता है तो ये ऑप्शन कंसिडर करिए, नहीं तो दूसरा ऑप्शन आईवीएफ आपके पास है। डेफिनेटली एक बार फर्टिलिटी स्पेशलिस्ट को मिलकर ही अपना डिसीजन आप लीजिए। आई होप इट विल हेल्प यू। ऑल द बेस्ट।
Thank you, Dr. Pooja. We're joined by Parentune expert, senior gynecologist Dr. Pooja Mittal to talk about how can PCOS and thyroid affect your fertility in this Parentune workshop. The next question comes from Sonali Chandran, who is 34 years old and is from Jaipur. She says, I have got my ultrasound done. My ovaries volume is normal in size. My periods are regular after every 25th day. My weight is also maintained at 56 kgs. Still, I am facing issues like appearance of peachy fuzz on my face and hair on stomach, and there is hair loss. The DHEAs is slightly raised. Could this still be PCOS? She further adds, I have hypothyroidism since the past 12 years, which is also in control. All other reports are normal. I am confused. I conceived my first child without any issue. Can I conceive again if my periods are normal? Please guide me. Dr. Pooja, this question is really long and she's given a lot of details. If you want me to specify some particular part, do let me know, please.
No, that's okay. I've heard. So, hi Sonali. So, I would say this DHEAS, that hormone you have mentioned, this is dehydroepiandrosterone sulfate. Is the sources of this hormone, they are not just from the ovary, they are from another gland in our body that is called the adrenal gland, and it lies at the top of the kidneys in our body. So DHEAS, very little portion of this hormone is released from the ovaries. Most of it comes from the adrenals. So whenever a lady's DHEAS is high, we need to check for ovarian disorders, one of which is the polycystic ovaries, but we also need to check for the adrenals. And you don't worry about it because it is completely treatable. If DHEAS is high in the body, such symptoms as you have told me, the peachy fuzz on the body, acne, hair fall, all those will happen because DHEAS is one type of a male hormone. And it is present in very small amounts in the female body. But when the levels are high in the female body, all these symptoms will happen. So one thing is, one needs to look at adrenal problems, adrenal tumors, or sometimes, when there is lot of stress going on, that can also cause DHEAS, to rise. And you need specific treatment, specific, medication to bring this down so that all these symptoms that you are facing, they can be controlled. You can definitely conceive again and the pregnancy can be normal. But first, you need to consult a good endocrinologist to look at the source of DHEAs and to treat it effectively. There is also, a lot of tests that are done. Sometimes we check for cortisol secretions also, which is an index of, working of the adrenal glands. As you said, all other reports are normal. So probably your ovarian function, the tests for polycystic ovaries, that has already been checked and found to be normal. But do consult a good endocrinologist. I suppose that, adrenals need to be checked and this DHES needs to be brought down. And then you can go ahead and try for a pregnancy. In the meantime, the way you have mentioned and you are doing it already, do follow a healthy lifestyle and exercise regularly. That will help you a great deal. Also, excessive stress can sometimes cause secretion of this DHEAS. So do stay happy and not take stress at all. I hope this will help you.
Thank you, Dr. Pooja. Um, Thank you so much for answering that. We hope, Sonali, that answers your question. Dr. Pooja has given a lot of detail to your question. And in case you have anything else to add, please let us know. Misha Manik is 28 years old and she says, I have heard there are 4 types of PCOS. My doctor did not tell me which one I have. How do I find out which type of PCOS do I have? Is this treatment same for all 4 types? She says, I'm a 28-year-old woman and my periods are regular but scanty. I was diagnosed with PCOS 5 years back due to complaint of pain in legs during periods. I got married last year. Will I have difficulty in conception even though my periods are normal?
Hi, Miksha. So some doctors, they do classify PCOS as, the main feature that is there into 4 types. So the first one, that is when, there is excessive male hormone and the symptoms come as, acne and either hair fall or excessive hair. The other one is the inflammatory types. The third one is the post pill, which is aggravated when the contraceptive pill is taken, and then when it is stopped, then these symptoms will happen. And the other one is the stress induced. So these are the 4. So I would say sometimes it is difficult to say which particular type of PCOS you have, because there may also be overlap. Because a person may be having stress induced symptoms also, and in addition, may be having irregular periods due to ovarian problems as well. So rather than, too much stress on the classification of the type of PCOS, I would say the more important is to treat the, disorder as a whole. And yes, the treatment can be curtailed to the amount of symptoms that a person has, the type of symptoms one has. So in women whom we see the stress is a big contributing factor, then we definitely ask for lifestyle changes, some meditation to relieve stress. And it goes on with all the PCOS, all the people who have this condition. Stress is also a very important contributory factor in PCOS, so it should be avoided. People having, excessive androgenic male hormones in their body and the symptoms are because of that, they are they are advised certain hormones to bring these hormone levels down, abnormal hormone levels down. The people who have this insulin resistance in their bodies, they are given insulin sensitizers. So yes, the treatment is a little different with different types of PCOS, and the features that you are having, that will decide what kind of treatment is to be given. If your, this PCOS remains controlled, the hormone levels are controlled, then most probably there would be no problem in conceiving. But some ladies, not all of them, some ladies, they need a little help, little treatment from their doctors to help them conceive. Also, it is very important to follow a healthy lifestyle and also to follow the treatment offered by your doctor, because PCOS, when present, it also increases certain complications during pregnancy. So, which is why do keep it under control by taking medication, following a healthy lifestyle, exercising daily, taking healthy balanced diet, avoiding stress. That would be one. So, all these things should go hand in hand. Do follow your doctor's advice on this, and with a good, pre-pregnancy check, so that all the hormone levels are determined for you and medication can be started for you. After that, you can start and go ahead, try to have a pregnancy. And most of the women with PCOS, they go ahead, have normal pregnancies and normal babies. Problems do not happen with all, particularly if you are following a healthy lifestyle. I hope this will help.
Thank you, Dr. Pooja, for answering that. We're joined by Parentune expert, senior gynecologist Dr. Pooja Mittal to talk about how can PCOS and thyroid affect your fertility in this Parentune workshop. The next question comes from Lautika Dayal, and she's from Delhi. She says, I have one child who's 9 years old. I'm 39 years old and recently diagnosed with PCOD. Will it be possible for me to conceive at this age with PCOD?
Hi, Lautika. So, I would say you should consult your doctor first. It can be possible to conceive at this age with PCOD also. But yes, rather than, you going ahead with on your own, I would say go for a preconceptional checkup and, tests which should be done. And also your ovarian reserve should be checked. So if the AMH levels, that is one hormone that is used to check for ovarian reserve, that comes good, then definitely you can, go ahead and try for a pregnancy. Regarding PCOS, if your symptoms are severe, like say your periods are very much irregular, or there is too much of a weight gain, or you are having symptoms of high male hormones, high androgens, such as abnormal hair, acne, or hair fall, then specific medication can be given to help you control these symptoms also, and to bring down the hormone levels, abnormal hormone levels as well. Apart from this, do follow a healthy lifestyle. Exercise at least 45 minutes every day, 6 days a week. Do take a healthy, balanced diet and avoid all the sugar loaded food, fatty foods, junk food, outside cooked foods. Stick to simple homemade food. Regulated meals, at specified times. Having early breakfast will also help you. Apart from this, taking adequate sleep and avoiding stress. So this is also a big, important factor in helping you conceive if you're following a healthy lifestyle. So I would say that you can conceive at this age, but go ahead for a preconceptional counseling and follow a healthy lifestyle. I hope this will help you.
Thank you, Dr. Pooja. Dr. Pooja, could you just again, for the benefit of everybody who's just joined in, talk a little about PCOS? What is exactly PCOS and how does it actually affect fertility of a woman?
So PCOS or polycystic ovarian syndrome, this is a hormonal disorder in women of reproductive age group, women who are of the childbearing age group, and it causes, symptoms such as irregular periods as well as other physical symptoms such as hair fall, abnormal hair, acne, weight gain, etc. So there are three parameters on which we decide whether a lady has PCOS or not. So first is the symptoms of high androgen levels. So high male hormone when present in the female body, it gives abnormal symptoms which include hair fall, acne, abnormal hair growth on the chin and tummy, central obesity, excessive weight gain, all this stuff. One thing is this. The second is the abnormal hormone levels, which are tested by taking blood sample. The third is the irregular periods. So these are the three parameters which are used to decide polycystic ovaries. So any two when present, then we say that the lady has this polycystic ovarian syndrome. Polycystic ovarian syndrome, that is, a hormonal disorder as well as a lifestyle related one. So, the when we don't follow a healthy lifestyle, that aggravates this condition. And also, when this condition happens, then excessive weight gain will happen, which will further aggravate the condition. So it becomes a vicious circle. And hence, it is very important to follow a healthy lifestyle as well as, do regular exercise to prevent the, various symptoms from happening. Polycystic ovarian syndrome, this will not only affect the lady's fertility or, having her pregnancy. Apart from this, during pregnancy also it increases the chances of certain complications, such as there are more chances of having a miscarriage, more chances of developing high blood pressure, high cholesterol, diabetes in pregnancy, also, a cesarean delivery during pregnancy, or, problems with the baby, such as a very small baby or a very large baby. Hence, it is very important to control PCOS. Since the periods have become irregular, the egg production also becomes irregular, which makes it difficult for a lady to conceive. Also, when polycystic ovarian syndrome is there, there are many, abnormal hormonal influences going on, which can prevent implantation and they can also cause abnormal miscarriages. So which is why polycystic ovaries can affect a lady's fertility, and hence it is very important to control it.
Thank you, Dr. Pooja, for answering that. Vishal Singh from Pune says, we have been married for 2 years now, and we're trying to conceive for more than a year. My wife's sister has endometriosis. My wife too has periods sometimes twice in a month, which continues for 7 to 8 days. Is this normal, or is this a sign of some underlying cause? Could this also be PCOD?
Hi. So yes, when periods are happening twice in a month, then that is not an very conducive to conceiving, because this suggests that she has some, either there is a hormonal disturbance, and yes, it could be because of PCOS also. But there are other conditions also which can cause such frequent periods, having periods twice a month. So some other conditions that can cause is other hormonal disturbances such as a thyroid, also conditions in and around the uterus such as fibroids, such as adenomyosis, and as you have said, endometriosis that is there with your wife's sister. So endometriosis can also cause this, other conditions like fibroids, infections of the uterus. So in case she is facing this symptom of having periods twice every month, she needs to be assessed by her doctor for everything. Apart from, the ultrasound, thyroid test, and polycystic ovarian, profile, which includes certain hormone tests, that should also be done and treated. Once the treatment is done, then lot of abnormal factors, or the factors which are hindering the pregnancy, they can be controlled, and then she can go on and try for a pregnancy. I hope this will help you.
Thank you, Dr. Pooja, for answering that. The next question comes from Cheena Malik, and Cheena says, I have thyroid since puberty. I'm on medication for the same. Recently, I got to know I have, she says she has Hashimoto thyroiditis. I want to conceive. Is it safe to get pregnant with this prolonged hormonal issue? Will it have an impact on my unborn baby? Is taking thyroid medication for so long safe for me and my baby?
Hi. So, yes, definitely you should take your medication regularly if you have thyroid problem, and particularly Hashimoto's thyroiditis. It is very important that you consult your endocrinologist, your thyroid doctor regularly regarding adjustment in the dose of this, thyroid hormone. So, Hashimoto's thyroiditis, that is one of the very common cause of having, autoimmune thyroiditis. That is also, it is also called as Hashimoto's thyroiditis, wherein antibodies are formed against your own gland, and which is why it's not able to function properly. So we have to supply the same hormone, the thyroid hormone, extraneously in the form of tablets, and that controls the thyroid hormone levels. But this in this condition, yes, probably the treatment is needed for years, for prolonged duration of time, and also the thyroid levels, they need to be done periodically to check whether any adjustment in the dose of the further adjustments are needed. You can conceive with this condition, but yes, you will have to be very regular with your medication as well as your checkups to the doctor. And also during pregnancy also, and around the time you have been you will be conceiving, that is the preconceptional time, that time also you will need frequent thyroid hormone checkup so that your dose can be curtailed according to it. It is safe, the medicine is safe for you and your baby to take. In fact, it is all the more important because for the first few months, the baby inside the uterus, in the womb, that depends on its mother's supply for the thyroid hormone. So it is very important to take this medication. Now you have asked about the effect of this condition on the unborn baby. So I would say sometimes this condition is seen to run in families. So yes, there is a little bit of tendency, or there are chances that the unborn baby will have this condition because you have had it. But overall, your baby, if you control this condition with medication, your thyroid hormone levels are controlled in a good way, then your baby will remain in good health. You'll have a normal pregnancy. And the surveillance during pregnancy might be increased a little. The thyroid level hormones may be done more frequently than otherwise. But if you follow all that and the hormone levels remain normal, the pregnancy will remain uncomplicated. The baby, there are also very few babies, very rarely, they have a condition called neonatal hypothyroidism, which is the development of thyroid from birth itself. But it is a very, very rare condition, and it does not depend on the presence of this, medication being given. So you should definitely take the medication during pregnancy. Speak to your doctor regarding, management during pregnancy, and your baby will be checked. All children, when born, they are checked for this condition at their birth these days. So will be checked, and if needed, medication will be given to the baby also. But otherwise, remain assured, once your thyroid levels are under control, then this condition doesn't affect your baby in a bad way. So all the best and take care.
Thank you, Dr. Pooja, for answering that question. The next question comes from Ujjwala, who says, "My age is 44, and for the last 2 years, my periods are getting delayed. My gynecologist gives me medicine, and then I get my periods. Also, I have a bulky uterus. So, is that a problem?" She's not mentioned if she's planning to conceive or anything, but she just says that, is that a problem?
So a bulky uterus can be because of many problems, and sometimes a little bit of a bulky uterus may not be anything to worry. So don't worry at all. What you need to do is a ultrasound probably and a checkup from your doctor. So if the bulky uterus is caused by a fibroid or a condition called adenomyosis, but since these conditions are not giving you any problem, no heavy periods, no painful periods, then I would say you should just be, it should be put on surveillance, repeating your ultrasound, maybe once every 6 months to an year, and also getting yourself checked by your doctor. But if there are no abnormal symptoms, this bulky uterus, no period problems, no pain in the tummy, then this bulky uterus may not be something to worry. The period pattern, you are saying that you are getting infrequent periods. So sometimes women, in the premenopausal or perimenopausal age, as we say it, they start having such a period pattern. So good would be to check with your doctor, and also to check for a condition related to the thyroid hormones. If the thyroid hormones are not regular, then also the periods will become irregular. Some other tests should also be done for you, such as a prolactin hormone test. These are some of the hormones that are important for regulation of cyclicity in the period. So if the periods are becoming infrequent, certain tests need to be done for you, and also an ultrasound. If these tests, all of them come normal, then I would say not to worry, just keep a track, do regular exercise, and just speak to your doctor to check if you are due for menopause. Many women, before achieving actual menopause, which would be somewhere around 48 to 50 years of age, but few years before that, their periods start becoming a bit irregular. And if that is the case, then there is nothing to worry. Just follow a healthy lifestyle, exercise regularly. Do speak to your doctor regarding checking up your hormones, your thyroid, your prolactin, and sometimes FSH, which is the follicle stimulating hormone, that can also be done to check whether a menopause is about to come on. Do follow your doctor's advice on this. All the best.
Thank you, Dr. Pooja, for answering that. Dr. Pooja, can you talk about some lifestyle changes that can be helpful for anyone who is planning to conceive and has specifically a PCOS or a thyroid as a condition?
So for both PCOS and thyroid, so in both these conditions, it is very important to have a good diet, a healthy balanced diet, and exercise regularly. So it is very important that one should avoid sugar loaded food, fried and fatty stuff, pre-processed snacks, food cooked outside, or very heavy food. It is best to stick to simple home made food, plenty of fruits and vegetables. Half a plate should be full of fruits and vegetables. Little bit of nuts should be included in the diet, and the rest of the half of the plate, that can be full of protein sources. It is also very important to regularize your meal timings, taking an early breakfast and taking the other two meals also at regular intervals. Some in between meal snacking can be done, but they should be healthy snacks. One would be that. Also, exercising is very important to control the symptoms of this polycystic ovaries, as well as exercise brings down the stress level and also increases the chances of achieving a pregnancy. So definitely exercise every day, 45 minutes a day, 6 days a week. The kind of exercise that you can follow, you should, consult your doctor and follow the advice. So this is very important. Apart from this, stress is also a very important factor in thyroid and PCOS both. So definitely avoid stress. If you feel that there are anxiety and mood issues happening with you, do follow up this with your doctor, as well as do some yoga, some meditation, some deep breathing and relaxation techniques that will go along. So this is important for both thyroid and polycystic ovaries. Both the conditions demand that you go for regular checkups with your doctor and follow the advice being given in terms of medication and tests also. So it is very important to take your thyroid medication regularly at the stipulated time, which is generally early in the morning, empty stomach, to get the thyroid hormone checked periodically to see if any adjustments in the dose is needed. That would be one. With thyroid, there are also some food changes, some dietary changes that should be made. So certain vegetables, certain stuff in our food that is considered goitrogenic, or if consumed in large amounts, then that is not very good for the thyroid hormone function. So some of these are these from the cauliflower, broccoli, and cabbage, ladyfinger, spinach, strawberries, certain vegetables that grow under the soil, such as sweet potato and yams. So these should be had in moderation, not in large amounts. Also, it would be good to cook these and then had, because then the goitrogenic chemicals or substances present in them, that gets reduced in amount. So this would be one. Follow up with your doctor and take the medication regularly. During pregnancy also, it is very important to follow the doctor's advice and follow a healthy lifestyle, so that the complications which both these conditions do increase to happen in pregnancy, they will be minimized. I hope this will help.
Thank you, Dr. Pooja. We're joined by Parentune expert, senior gynecologist Dr. Pooja Mittal to talk about how can PCOS and thyroid affect your fertility in this Parentune workshop. Please ask your questions and we'll take them up in a short while. The next question comes from Shweta Gupta, who says, how complicated is it to conceive if one has PCOS and has high AMH level like 10, but do not have any other symptom? How long a couple can take to achieve pregnancy in this case?
Hi, Shweta. So PCOS increases this AMH level, which you have, mentioned. With women who have PCOS, they are generally found to have high AMH levels. So one can go on and, try to conceive. The time that one should try naturally to conceive depends on the age and also on the social factors, how much of a hurry the couple is in. I would say in a young couple with these conditions but no other problems otherwise, it is good to give an year. However, if the age is, towards the higher side, it is, beyond 35 years of age, then such a long time we do not take. We give 6 months for natural try, and then, if a success is not achieved in terms of a pregnancy, then we offer help. Yes, women with AMH, high AMH, they can conceive, but sometimes some treatment, some medication to control the hormone levels of polycystic ovaries, that is needed, and some surveillance on part of the doctor, such as an ultrasound and all, that can be needed. But one can go ahead and try to achieve a pregnancy. 6 months, if the age is not much and socially they are not much in much of a hurry, if it socially they are in a hurry, and 1 year if the condition says otherwise. So this is how one can go ahead and try for a pregnancy. Do in each situation, do stay in touch with your doctor and follow the advice regarding this. This condition PCOS sometimes demands that we give certain medications, certain supplements that should be taken, and also follow a healthy lifestyle, take a healthy diet and exercise regularly. I hope this will help.
Thank you, Dr. Pooja. Rachel Dipti says, what you should, hi, doctor, could you please suggest what you should eat and what you should not for a healthy pregnancy?
So the dietary guidelines, they would be, as I've already mentioned, it is good to stick to simple homemade food. So no junk food, no outside food or food that is full of or loaded with oils and ghee, or fried stuff, pre-processed snacks, all these namkeens, cookies, all this stuff, sweets, all these should not be had. Apart from this, I would say that even these cold drinks, too much of tea and coffee, All these don't do our body any good. So stick to homemade diet. Include plenty of fruits, vegetables, leafy greens. Little bit of nuts every day will do very good. Then we can take cereals and sprouts. Also, dals and legumes, soya bean, rajma, chana, all this stuff can be included. If non-vegetarian habits, eggs and lean meat and fish, all these should be included. Now the timing of diet and timing of meals, that is also important. So an early breakfast, a good breakfast is also a key to good health. That would be very good to take. The meal should be adequately spaced out. Mid meal snacking should also be done in pregnancy, particularly when the energy demand of the body is high. So the healthy snacks can be included, which may include a little bit of nuts or fruit, or liquids in the form of soups and coconut water or lassi and chach. All this should be had. Apart from this, I would say processed snacks and the things that are made of maida, uh, they don't give us much. All the nutrition has been taken out of them in the process of processing the food. So all these should be avoided, and whole grains, whole wheat atta, that should be used. So these are the general dietary guidelines. Milk is also, milk and dairy products, they are also very good. One should have them in plenty. But adding too much of sugar, particularly white sugar, processed sugar, that will not be very good. So, milk should be had, but very little sweetening should be done, and preferably with honey and wood. So, this would be the general dietary guidelines. Apart from this, for a healthy pregnancy, it would also be very good to follow a healthy exercise routine. Do consult your doctor to know what kind of exercises one can do safely. Also, take your supplements regularly as advised by your doctor. So, these are some of the dietary advices during pregnancy.
Thank you, Dr. Pooja, for answering that. Neha says, I have thyroid. How long should I try to conceive before seeking a doctor?
Hi Neha. So I would say firstly, control your thyroid levels. If your thyroid, you are already taking medication and your thyroid levels are already controlled, then you can go ahead and plan a pregnancy. And the time you can take before, asking a doctor for help, that would depend on your age, any other problems, or, social factors such as how much of a hurry you are in. So in case of young couples, I would say less than 35 years of age, healthy couple, no other health issues apart from that you have mentioned the thyroid one can take 1 year, but you should also know regarding the fertile period. If in a regular cycle, regular 28 to 30-day cycle, day 11 to day 18, that is counted as the fertile period. So do try for a year during the fertile period if that is the case. In case socially you are in a hurry because of any reason of your own, you want to hurry up for a pregnancy, or the age is more than 35 years, or there are more health issues with the couple apart from this thyroid, then I would say 6 months is an adequate time. If there is no success achieved in 6 months, then you can, you should ask your doctor for help. I hope this will help.
Thank you, Dr. Pooja, for answering that. Dr. Pooja, what are some things every woman with thyroid must do, generally in day-to-day life, and if they are planning to conceive?
So with thyroid, one thing would be regularity in taking medication, regularity in getting yourself checked with your doctor. So definitely take your medication and the blood test, that is, periodically done to check for the levels of thyroid, if they are normal or not, if any drug adjustment, adjustment is needed, that should be done. Another thing is thyroid also causes an increase in tendency to gain weight. So which is why with thyroid it becomes all the more necessary to follow a healthy lifestyle, healthy diet, as well as exercise regularly, because since your body has a tendency to gain weight, and as you gain weight, then the period problems and all that will happen. So hence it is very important to exercise regularly and follow a healthy diet as well. Apart from this, stress also affects your weight and your hormone. So taking not taking stress, as well as following some healthy yoga or meditation or deep breathing and relaxation techniques, following a hobby of your own on a regular basis to keep your mood good, that would also be important. Thyroid can also cause mood changes, anxiety problems in women. So if that is happening, one should speak to a doctor. Try to keep yourself constructively busy to keep your mood in good way. So that would be one. Apart from that, thyroid, certain dietary changes should be made. Certain vegetables, they should be cut down and eaten in moderation. So these, these are called goitrogens. They contain substances which are not good on thyroid. So some of these substances are, sweet potato, yams, and also cauliflower, spinach, cabbage, broccoli, strawberries, and some other vegetables also. So all these should be had in moderation, and preferably when they are being had, one should have them cooked rather than having raw. So these are some of the precaution that people with thyroid problems they should take.
Thank you, Dr. Pooja. Arushi says, how do I know that I have a mild or severe PCOS? What are some of the signs and symptoms of PCOS?
Hi, Arushi. So, as such, there is no gradation in the mild and moderate or severe kind of PCOS. Some of the symptoms would be a tendency to weight gain, irregular periods, that is the periods coming, not happening adequate time, 21 to 35 days. Either they are delayed or they are prolonged, and sometimes they happen frequently also because of hormonal disturbances. The others are related to high levels of male hormones in the body. So some women with PCOS, they also experience symptoms such as hair fall, oily skin, acne, abnormal hair such as hair on chin and tummy, and also sometimes pigmentation patches, particularly on neck. Also, women with PCOS, they may also show a tendency to have high cholesterol, sometimes, because of the weight gain, as well as because of the insulin resistance, they sometimes develop high blood sugars. So these are all the symptoms of a PCOS, and there is as such no mild or moderate or severe variety. But yes, in general terms, we say if the all the symptoms, somebody showing all the symptoms, then we say yes, they have a severe form of it. So to curb it, do follow a healthy lifestyle, exercise regularly, and do consult your doctor for an advice on medication to bring the hormone levels down. All the best.
Thank you, Dr. Pooja. Hope Arushi that answers your question. Trisha says, should one avoid gluten-based diet or dairy products like milk and curd, etc.? Also, does taking boiled eggs every day increase the testosterone levels in a woman?
I would say that any food eaten in moderation, that is good. If you take excess of anything, that is not good. So I wouldn't say that taking eggs increases the male hormones or testosterone in the body. But since egg is very rich in fat and cholesterol, so having it too many in number would not really be good. So I would say having one boiled egg would be good. If you want to have two, then you have to strike the yellow area off. The yolk should be removed. So that is okay to have egg. It will not increase the male hormones in your body. And regarding the gluten and lactose free diet, I would say that it is required only if one is allergic to these particular constituents of the food. So there are people who are allergic to gluten, and that causes gut problems in them. There are also people who cannot tolerate milk and they are allergic to lactose. So in those people, these foods should be avoided, but otherwise it is not indicated that one should avoid them completely. However, again, I would say moderation is the key. So when having wheat, you should, it's not that each meal of the day will or should have, only wheat. Include different types of grains to, get the benefit of all kinds of, vitamins and nutrients and antioxidants. Same with milk. I would say that, having it as per your body's requirement would be good, but when had in excess, milk can also cause excessive weight gain since it is rich in fat. So I would say moderation is the key. Otherwise, any of these foods, they do not aggravate this condition, PCOS or thyroid.
Thank you, Dr. Pooja. Dr. Pooja, please mention three do's and three don'ts for anybody planning to conceive.
So the three, first we mentioned the three do's. So first way to would be to follow a healthy exercise routine, a regular exercise routine every day. It is good to do 45 minutes of exercise every day. The kind of exercise you should ask your doctor. But otherwise, I would say start with brisk walking, and you can also do yoga. One would be exercising, other would be to take a healthy balanced diet. So avoid all kinds of fatty or fried or oily foods, sugar rich food, pre-processed food. and snacks which are prepared outside, all these should be avoided. The other thing to do would be to avoid stress. And because stress is also very important for fertility and also for general well-being of your body. So in case one does feel overwhelmed sometimes, do follow a hobby of yours to keep your mood stable. In case help is needed in terms of anxiety issues, then do consult your doctor. Do some relaxation techniques, some yoga, some meditation, some deep breathing, that will really help. Some things that should not be done, one thing would be smoking and alcohol, because they don't really help in any way. And particularly when trying to conceive, it is very important to get rid of these habits. One thing would be that. Other would be, do not neglect or overlook any of the conditions or any of the health issues that are with you. Never ever overlook it. Do consult your doctor for a preconceptional counseling. If any of the conditions such as a thyroid or a polycystic ovaries is present, it requires to be treated adequately. So, whenever trying to conceive, never overlook your problems. Do speak to a doctor for adequate treatment. And third, don't would be to neglect your medication, to neglect your lifestyle. So be very regular with a healthy lifestyle as well as your medications when needed, and ask for help. It is very important to ask help from your doctor if needed in terms of medicine.